Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Darunavir. Its brand name is Prezista. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Darunavir. We'll then discuss examples of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Darunavir is a HIV-1 protease inhibitor. It prevents the cleavage of GAG and GAG-POL polyprotein, yielding immature, non-infectious virus. In terms of indications or reasons we would prescribe this medication to a patient, well, we would often see this medication prescribed in the treatment of an HIV infection. With respect to contraindications or reasons we would not be able to prescribe Darunavir, well, we wouldn't give this medication to a patient who had a hypersensitivity to Darunavir or to any other component of the formulation. It should also be noted that there are many drug interactions with this medication that would also be a contraindication, meaning that you couldn't use this medication with a lot of different medications. Some examples of these would be lovastatin, simvastatin, cisapride, or colchicine. Now for an example of dosing with Darunavir, so in the treatment of an HIV infection, in a treatment-naive patient, we may see 800 milligrams orally once daily with ritonavir, 100 milligrams orally once daily, and this would be taken with food. In treatment-experienced patients and at least one Darunavir resistance-associated substitution, or with no baseline resistance information, we may give 600 milligrams orally twice daily, again with ritonavir, but this time at 100 milligrams twice daily, and again it would be taken with food. As with all medications, there are some side effects or adverse reactions that patients may experience while using Darunavir, so we'll go over some of those here now. About 8% of patients may experience a rash, while 3 to 10% of patients may experience hypertriglyceridemia, which would be a rise in your serum triglycerides. Serum cholesterol may be raised in up to 25% of patients. Abdominal pain seems to happen about 6% of the time, and diarrhea 9 to 14% of the time. 4 to 7% of patients may experience nausea, and 2 to 5% may experience vomiting. A headache seems to happen in 5% of patients. Now, some more rare but serious side effects would be diabetes mellitus, Stevens-Johnson syndrome, toxic epidermal necrolysis, or pancreatitis. Alright everybody, that's all we're going to talk about today with Darunavir or Prezista. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.